First aid is the immediate help you give someone who's injured or sick. It involves simple yet effective techniques that can stabilize a person's condition until professional medical help arrives. Knowing what to do in those critical first moments can make all the difference. In many emergencies, the first few minutes are crucial. Immediate action can prevent a condition from worsening and can even save lives. For instance, performing CPR on someone who has stopped breathing can keep oxygen flowing to their brain and other vital organs until paramedics take over. Knowing basic first aid can be the difference between life and death. Imagine a scenario where someone is choking, and you know the Heimlich maneuver. Your knowledge and quick response can dislodge the object and restore their breathing. First aid isn't just about physical treatment, it's also about offering reassurance and support. Your calm presence and confident actions can help reduce their anxiety and fear. Before you rush in, take a moment to assess the situation. Safety is paramount. Make sure the environment is safe for you and the injured person. Look for dangers like fire, falling objects, or traffic. Once you're sure it's safe, check if the person is responsive. Gently tap their shoulder and ask loudly, "Are you okay?" If they respond, introduce yourself and ask for their permission to help. If the person is unresponsive, it's time to check their ABCs. Airway, breathing, and circulation. This is the foundation of CPR, or cardiopulmonary resuscitation. First, ensure their airway is open. Tilt their head back gently by lifting their chin. Next, check for breathing. Look for chest movements, listen for breath sounds, and feel for breath on your cheek. Finally, check for circulation by feeling for a pulse on their wrist or neck. Bleeding is a common injury that requires prompt action. First, protect yourself by wearing gloves if available. Apply direct pressure to the wound using a clean cloth. Elevate the injured limb above their heart to slow down blood flow. Encourage the person to keep pressure on the wound while you call for help. Never remove an embedded object. This can cause further damage. Instead, pack around the object with clean dressings. Section 5. Choking, clearing a blocked airway. Choking occurs when an object obstructs the airway. If someone is choking, they'll usually clutch their throat. Ask them, "Are you choking?" If they can't speak or cough forcefully, perform the Heimlich maneuver. Stand behind them, make a fist with one hand, and place it above their navel. Grasp your fist with your other hand and thrust inward and upward forcefully until the object is dislodged or they become unconscious. Section 6. The burning issue. Treating burns effectively. Burns are a common injury that can happen to anyone, anywhere, and at any time. Knowing how to treat burns effectively can make a significant difference in the healing process and can prevent further complications. In this section, we will guide you through the essential steps to take when dealing with different types of burns. Burns can be caused by heat, chemicals, or electricity. Each type of burn requires a specific approach to treatment. Heat burns, also known as thermal burns, occur from contact with hot objects, flames, or steam. Chemical burns result from exposure to harmful substances, while electrical burns are caused by contact with electrical currents. Understanding the source of the burn is crucial for administering the correct first aid. Cool the burn immediately with cool running water for at least 10 minutes. This helps to reduce the temperature of the burn, alleviating pain and minimizing tissue damage. It's important to use cool water, not ice cold, as extreme cold can further harm the skin. If running water is not available, use a clean, cool, wet cloth as an alternative. Remove any clothing or jewelry near the burn, but don't try to peel off anything stuck to it. Clothing and jewelry can retain heat and cause further damage to the skin. However, if the material is adhered to the burn, attempting to remove it can cause more harm. Instead, cut around the stuck material and seek medical attention. Cover the burn with a clean, non-stick dressing. This protects the burn from infection and keeps the area clean. Non-stick dressings are ideal because they won't adhere to the wound, making it easier to change the dressing without causing additional pain or damage. If a non-stick dressing is not available, a clean plastic wrap can be used as a temporary measure. Don't apply ice directly to the burn, as it can damage the skin. Ice can cause frostbite and further injure the already damaged tissue. Instead, focus on cooling the burn with water and protecting it with a clean dressing. Avoid using any creams, oils, or butter on the burn, as these can trap heat and increase the risk of infection. For chemical burns, Brush off any dry chemicals before flushing with water. It's important to remove the chemical substance from the skin to prevent further damage. Once the dry chemicals are removed, rinse the burn with cool running water for at least 20 minutes. If the chemical is in the eyes, flush the eyes continuously with water and seek immediate medical attention. Always wear protective gloves when handling chemicals to avoid further injury. In cases of severe burns, it's crucial to seek professional medical help immediately. Severe burns can lead to shock, infection, and other serious complications. While waiting for emergency services, continue to cool the burn and keep the person calm and comfortable. Avoid giving them anything to eat or drink, as they may need anesthesia or surgery. Remember, prompt and appropriate first aid can significantly improve the outcome for burn victims. Section 7. Broken bones, first aid for fractures. A fracture is a break or crack in a bone. Signs of a fracture include pain, swelling, deformity, and difficulty moving the injured area. Immobilize the injured area using a splint or sling to prevent further damage. Support the injured limb above and below the fracture. Apply a cold pack wrapped in a towel to reduce swelling. Never try to realign a broken bone. Seek immediate medical attention. Section 8. Stay calm, get help. The importance of calling for backup. In any emergency, staying calm is crucial. Your calm demeanor can help reassure the injured person. Once you've provided basic first aid, call 911 or your local emergency number immediately. Provide clear and concise information about the situation, location, and the injured person's condition. Don't hang up until the dispatcher tells you to. Follow their instructions carefully. Section 9. Be prepared, your first aid action plan. In this section, we will guide you through the essential steps to ensure you are ready to handle emergencies effectively. Whether it's a minor injury or a critical situation, having a well-thought-out action plan can make all the difference. Being prepared can save lives, including your own. It's not just about having the right tools, but also about knowing how to use them. Imagine being in a situation where someone is injured and you are the only one who can help. Your preparedness can turn a potentially tragic situation into a manageable one. Take a first aid and CPR course to gain confidence and skills. These courses are designed to teach you the basics of life-saving techniques, such as how to perform CPR, how to stop bleeding, and how to treat burns. The knowledge you gain from these courses can be invaluable in an emergency. Keep a well-stocked first aid kit readily accessible at home, in your car, and at work. Your first aid kit should include items like bandages, antiseptic wipes, adhesive tape, scissors, and pain relievers. Regularly check your kit to ensure that all items are in good condition and replace any that are expired or used up. Remember, the first 10 minutes are critical in an emergency. During this time, your actions can significantly impact the outcome. Call emergency services immediately and provide as much information as possible. Stay on the line until help arrives, and follow any instructions given by the operator. By learning basic first aid, you can make a real difference and potentially save a life. Knowing how to perform CPR, how to treat wounds, and how to handle other common injuries can empower you to act confidently in an emergency. Practice these skills regularly to keep them fresh in your mind. Be prepared, stay calm, and act quickly. In an emergency, your ability to remain composed and take decisive action can be the key to saving a life. Remember, every second counts, so trust in your training and your preparedness. Your actions can make a world of difference.